Hey everyone, this is Dr. Patterson and welcome to week 6. This week we're going to focus on the gastrointestinal and musculoskeletal systems. First, I'd like to check in with you all and make sure everybody's doing well. I can't believe it's already week 6. It's crazy. There's only a few weeks left, so we're starting to wrap up the semester. We're then going to talk about the weekly guide, important system assessment concepts, and also a case study. Important points from week 5. We described the components of the neuro exam and collected pertinent health history information. We wanted you guys to be familiar with assessing the neurologic status of your patient and familiar with the anatomy and assessment skills of the reproductive system. Also identifying the risk factors and symptoms for STDs, BPH, and certain genitourinary infections. This is the weekly guide to be completed before lab, so you're to watch the check-in video. You want to review your anatomy and physiology as needed. You are to watch some multimedia lectures on the GI and musculoskeletal systems and mark them as reviewed. Read assigned pages in Jarvis chapters 22 and 23. And also review the physical assessment of the adult step-by-step viewing of the abdomen and musculoskeletal systems in the ATI modules. And then also review the skills lab information. What I want y'all to do for the skills lab information is whenever you're watching these ATI videos, I want you to pull out your rubric, specifically for GI, your checkoff rubric, and I want you to watch them while you're looking at your rubric and watch the skills and be able to compare those skills with each other. So I think that'll help you narrow down your assessment skills and be more prepared for lab. The weekly guide, the assignments to be submitted are your documentation note via MedAffinity, and it's going to be for your GI system on Anamyelum. It is due Sunday, July 26 at 11:59. We have quiz 3. It opens on Monday, July 20th at 8 a.m. It is due July 26th by 11:59 p.m. It is open book, open notes with 3 attempts, and your highest scores recorded. We also have a case study to be completed by August the 2nd, and that's just looking ahead. Important system assessment concepts for GI. As with everything, we use Olcarts as our guide, but for the subjective info, we want to think about appetite, dysphagia, food intolerance, abdominal pain, bowel habits, nutritional assessment, and we can ask them if they've had any nausea or vomiting. The bowel habits, if you can actually see the stool, that would be objective information, or if you can actually see the nausea and vomiting, that would be objective information as well. For objective information, you have the abdominal contour of the abdomen. There's a really good picture in your book that shows what a flat abdomen looks like, a rounded, scaphoid, and protuberant, and it's a really good diagram, so I'd recommend looking at that. Also, symmetry of the abdomen, the umbilicus. Do you have any striae, moles, or lesions of the abdomen? Any abnormal pulsations, bowel sounds, and vascular sounds, and also light palpation. Important system assessment findings, especially when it comes to documentation. For inspection, a normal finding would be an abdomen that was flat, non-distended, symmetric, with the surface that is smooth and even. Bowel sounds present in all 4 quadrants on auscultation, and no vascular sounds auscultated. For abnormal, you would have maybe an abdomen that was protuberant, asymmetrical, with localized erythema on the right upper and lower quadrants. That's just an example. Or you may have bowel sounds hypoactive or not present at all in all 4 quadrants. Keep in mind that you have to listen for a full minute to say that somebody has no bowel sounds. For our case study, we have Tina, and she is having complaints of stomach pain on her right side for 3 days now. And she says it is worsening. She also says she hasn't had much of an appetite. Her past medical history, she is a 42-year-old Asian female who has no history of GI complaints. Her past medical history is significant for a history of migraines and seasonal allergies. In her past surgical history, she had LASIK eye surgery in 2018. So we need to think about what are some other history and assessment questions we would want to ask her, and also what assessment techniques would you want to use. And that's it, everybody. I hope everybody has a great week, and we look forward to seeing you in lab. Please let us know if you have any questions or concerns. Thank you.